Hey everyone, it's Naomi Wolf, and I'm so excited to be here with one of my favorite guests, Dr. Robert Seik of the Wellness Company. Welcome back, Dr. Seik.
Oh, thanks for having me on again, Naomi. Good to see you.
It's so great to have you. Dr. Seik is the owner of a pharmacy in Las Vegas, Nevada. He is also the chief of Integrated Therapeutics at the Wellness Company, and such a fascinating source of wisdom about generally how to stay healthy. And I'm excited to be speaking with you today, in particular, Dr. Seik, because you have three important new products that the Wellness Company has brought out. Each of them super newsworthy given the times we're living in. So let's start with the first one, early treatment. Tell me about that, please.
Well, what the Wellness Company has launched is one kit that is available. It's a medication kit. We call it the Emergency Preparedness Kit. And it's 8 different medications. 6 of them are antibiotics, anti-infectives. One of those is ivermectin. There's also an anti-nauseant drug. And sometimes what happens when you take an antibiotic is you can get a rebound fungal infection. So it's fluconazole. And why this was important for the clinical team to make available for the public is we've seen, Naomi, disasters that occur at various parts of the country, whether it's a hurricane or, that horrible disaster in Lahaina. Patients may not always have access to even what is most convenient in medicine, I think, today is telemedicine. I've used it. I've used it for my kid. It's really convenient. But what if you don't have access and you need to start treatment right away? You think about having antibiotics, particularly if you are at an infection risk. So I commonly point to the diabetic who may have problems with wounds. You don't want to get a serious skin or skin structure infection. People know who are predisposed to pneumonia. They know when they're coming down with the pneumonia. Early treatment is so crucial. Right. And when I've had pharmacist colleagues of mine, criticize me, right, this is just so reckless dispensing these antibiotics to people without an infection. Did you know that in Europe and South America, most of these drugs, in fact, all of them are available over the counter without a prescription because it's important to give people access. So that has been going really well. We've had that kit actually on the market for a while, and the public adoption of it has been great.
I'm so glad to hear it. This raises so many interesting questions that are beyond medical. They're kind of social, like why are Europeans and people in South America trusted to buy their own over-the-counter antibiotics, and we need to go through doctors in the United States? Is there a medical reason that you have to have a prescription for antibiotics, or is it just one more pharma gateway?
No, I think there's 2 sides to it. So having access early, I think, is important. Okay, that's why telemedicine is beautiful to work with, because I can schedule a consult right now with the telemedicine app that I use. And having a medical practitioner be able to consult the patient is crucially important, because you just can't recklessly use the antibiotics. There are precautions. We have an entire guidebook. The Wellness Company has an entire guidebook for this. So let me give you one example. Certain drugs can alter the heart rhythm. So we call that QRS complex, QRST, the QT interval, these things. Certain drugs can elongate that. Now, for the short-term use of antibiotics in people, it's, the risk, is overshadowed by the benefits. The benefits outweigh the risk in situations where we can't let this person get a serious infection. So short-term use of the antibiotic is okay, but there's a consideration for which antibiotic is chosen if that person really has a difficult time controlling their heart arrhythmia. And there's some important pre-care and post-care notes as well. I like for people to be informed of how to prevent infection and recognize whether or not they have a true bacterial infection that needs to be treated with antibiotics, and then the aftercare. Because I'll give you this little health point. Your human body is made up of 10 trillion cells, okay? But there are 100 trillion bacterial organisms that live in our gut, the 30-foot tube from end to end. And there's ones that belong there that are beneficial. That's your beneficial microbiome or your gut flora. And yes, you can disrupt that with antibiotics. So it's important after a course of antibiotics, especially, to repopulate your gut with beneficial probiotics. And if you skip that step, okay, you can have some downstream negative effects. So what I just told you are important points for people to be aware of. And that's why, in my opinion, you at least should have some knowledge or have access to somebody that you can consult, because maybe it's a little bit reckless because there just aren't enough medical practitioners in South America.
Mhm.
There's some downsides to just having the drugs available without the proper education. So what we've done in our kit is we have the medications available. We encourage people to say, look, this is not for you to treat yourself if you don't have access to a provider.
Right.
This is for you to have early treatment just in case you don't. But as soon as you do have access to a provider, make sure you get a proper consult and study the guidebook because it has all the warnings and precautions that would come with a consult that I would give somebody in the store.
Got it. Well, that makes very good sense. And, we're living in such precarious and unstable times. I can also see how an emergency would make it hard to, reach a doctor. What if the roads are blocked? What if the, cell towers are down? So that would make, like, I want to go ahead and order that right now for my family. That makes sense. Here's a question. What allowed you, is there some regulatory barrier to giving people antibiotics without a prescription? Were you able to get around that, or how were you able to get around that?
Well, there's no limitation for what the pharmacy can do in that regard, right? It still need a prescription. So the medical practitioners, physicians, nurse practitioners, physician assistants that work for the wellness company, they have to ultimately provide the clinical consultation and provide the patient with the appropriate information. Look, this is the case-by-case situation which you use it. There has to be proper medical screening because here's another example. There is a sulfa-based drug. Bactrim DS is the branded name, so sulfamethoxazole with trimethoprim. That has a lot of application, but if you have a sulfa allergy and that's reported to the medical practitioner, that's part of the screening, we have to remove that.
Right.
We can't take the risk of somebody with a sulfa allergy taking the drug. But the reason why there are so many products in the kit is most of the organisms that sulfa drug would cover. Another drug, the brand name is Augmentin. So it's amoxicillin with clavulanic acid that improves its effectiveness. That covers almost all of the same organisms.
Mm-hmm.
So that's why there's different ones to choose from. But from a safety standpoint, it's called drug utilization review when a pharmacist reviews the kit. And patient has noted a history of sulfa allergy. We cannot add the sulfa medication to the kit, but they have enough antibiotics that cover the other organisms and the situations that they're in. So if you have a protozoal infection, giardiasis, that's recognizable. It's in the kit for that. So the proper medical consultation along with the information goes with the kit. And it's been successful. We've been at it since late July.
Amazing. And is that what you'd call the early treatment product, or is that the emergency medicine product?
So we're calling it right now the emergency medical kit, and it is designed for early treatment in the event of an infection. Ivermectin is included in the kit, and we've worked for a little while on the next kit. So this one is launching this Friday. So this is the marketing this Friday.
Amazing.
It's the COVID emergency kit.
Oh, wow. Tell me more about that. My goodness.
Well, we're headed into the fall. Upper respiratory infections, particularly ones of a viral nature, start to onset now. Mm-hmm. And why do they onset? One of the reasons we talked about on your last show is the weather gets colder, there's less sun, people get less sun exposure, and they're more predisposed to infection. And there are a number of articles that show the sooner you start either hydroxychloroquine or ivermectin, in severe cases both, the better the outcomes of COVID, right? Because you've got to start to knock the viral load down before your case is so severe that you get admitted to the hospital. You can definitely reduce hospitalization dramatically. And I kind of have a, not necessarily a joke, but let's say I'm cynical with my pharmacy school classmates and my former research colleagues. I worked in biotech. Why do you think this stuff works for COVID? Have you looked at the data? Have you looked at the abundance of studies that are available? Well, that was during the peak of COVID. So 2019, 2020. Mm-hmm. Last year, I had a number call me and say, look, I'm sick. I think, can you get me an appointment with the telemed doc? I just want to try it. I feel terrible. Mm-hmm. And I told all my classmates, I'm glad to help you, no matter how much you ridiculed me. But here's what I don't want you to do. I don't want you to get sick at 2 o'clock on a Friday afternoon and tell me. Because then it's very difficult for me to get you an appointment with a telemedicine doctor that I know. Right. I'd coach your own doctor, but so many still reject the use of hydroxychloroquine and ivermectin, and I might not be able to ship it to you. So this is crucial. Right. Having the medications on hand is just so key and so important. I'll give you one more point, if you don't mind. We talked about the risks with the antibiotics and proper use, which we're really big on educating through the consult and the material that comes in the kit, in the guidebook, all of that, proper utilization. And what I have told many of my colleagues about medications like ivermectin, hydroxychloroquine for COVID, is I've asked them this question: what's the downside? Far less risk associated with these medications than those associated with antibiotics. So it's just elementary in our minds to have people be able to stock this kit in the event of, what if our supply chains are disrupted?
Right.
Major thing is, if you get sick, start early.
Right, right. What you're making me think of, I mean, as so many parents have asthmatic children, and that can quickly go from a very mild situation to a very dangerous situation. And we all stocked, treatments at home, and we were allowed to. We had the nebulizer, we had the steroids, we had the inhaler, and this sounds like that same kind of just to be safe, reassuring. What if my mom gets really sick on a weekend, or yeah, no, I like these. Seem like very, very good kind of basic safety products to have, like a carbon monoxide detector or a smoke detector, something, first aid kit, something to add to your family's kind of wellness pantry. And I can also see one other thing, and sorry to always go from like the medical to the social, but that's my, that's what I know about. I'm not a medical doctor. I imagine, hydroxychloroquine, these interventions have been so stigmatized and made so like creepy sounding and scary. I can imagine, like, I want to send this kit to some loved ones of mine who are, deep, NPR listeners and New York Times watchers, because I think just having the kit could demystify early treatment. Like, this is from a real company, and it's really a medication, and it's not some weird magical incantation. I think that would help a lot, to just, like, I'll give you an example. I had miraculous outcomes with Dr. McCullough's 10% betadine rinse, nasal rinse. We may have talked about this. So easy. I was over COVID in 24 hours. It worked for 4 of my loved ones. But I got yelled at by a relative who's a scientist, even though betadine has been in use in hospitals for decades, as I understand, as an antiviral rinse. And I feel like someone like that, who's so like irrational, might calm down if they could kind of look at the products themselves, read the labels, might help them think objectively. Is that too much to ask? Or are people saying, like, it's been useful to have this in the house just to, have more substantive discussions, or to get over people's fears?
Let me key in on one word that you mentioned that I have used many times when talking with colleagues, pharmacists, or medical practitioners, and that's objectivity. You must be a good scientist and think logically, because what the pharmaceutical industrial complex has locked is medical school education and protocols. In fact, I read an article recently that United Healthcare now employs 70,000 physicians. They're corporate medicine physicians. And during the 2-year time of COVID, 60,000 private practice physicians went out of business. So you're a slave to protocol. And I cynically challenge some of the doctors who throw it in my face that, oh, your kids didn't get the COVID vaccine and they're around my kids. How dare you believe in hydroxychloroquine? So, you're sentenced to your protocols. You're an expensive box checker.
Wow.
I know that primary care sees
a
patient.
You say that? Oh my gosh.
Oh, I say that. Well, I'm 50 years old now, Naomi. 20 years ago, when I was lecturing to doctors, I was much more passive in how I would talk. But I use these tools. You're an expensive box checker as a trigger, because I know there's an analytics company called Merritt Hawkins. The average primary care visit today is 7.6 minutes.
Oh my.
It's 1 problem, 2 prescriptions.
Oh no.
Now, when you're working for one of, I call them doctor in the box, expensive box checkers, you're working for one of the corporate medicine facilities, you're only promoting what the corporation says to promote. So I challenge all of these people, be objective, because number one, what's the downside? Hydroxychloroquine and ivermectin, both have been used for over 60 years in many countries, in the very young and the very old. And in any country that keeps an adverse drug event reporting database, there's very little associated with the drugs, not zero, but very little associated with adverse events.
Right.
Proper precautions. If you have a severe heart arrhythmia called torsades de pointes, turning of the points, okay, maybe we have to consider whether or not the benefits of hydroxychloroquine outweigh the risk. There's some issues with overdosing or very high dosing of ivermectin and potential accumulation of a neurotoxic metabolite. But again, this is short-term use for ivermectin. And back to hydroxychloroquine, people have used it for decades for autoimmune disease, and all of a sudden this drug is vilified as being bad and toxic. And then let's go back to ivermectin. Last point. 4 men shared the Nobel Prize in Science and Medicine in 2015 for their work on ivermectin in humans, and it was far beyond the application of just river blindness, for which it was initially approved. So why? It's an agenda. You and I know it. It's a big pharma agenda because these cheap drugs that were widely available must be vilified to give rise to very expensive treatments like the vaccines for prevention. Paxlovid is a scam. That's a rebound drug, and we're looking at recent clinical articles now that show increased risk of cancer for patients who take Paxlovid, but no improvement actually in the outcomes of COVID. You may get an initial viral count decline, but then they rebound. So back to hydroxychloroquine, ivermectin. Again, what's the downside? That's what I challenge all the scientific minds to. Tell me, what's the downside?
Wow. I mean, the downside is I guess they'd lose their jobs if they don't hand out those 2 prescriptions in 7 minutes. But that's not our concern, right? We want to get the objective information. That's why the wellness company is such a valuable addition to people's choices. And so you've gone over 2 different new products. You have a third one, is that correct?
Well, this one is not new. It's the Spike support product. And, Dr. McCullough has talked about this. Dr. Peter McCullough has talked about this on a number of shows. And there's recent data that shows that variations of actually using protocols, natural protocols, to attack the spike protein are very effective because we have acute COVID that we can treat that I'm concerned about for the fall. But you have a number of patients who are long haulers. Why are they long haulers? They either have persistent virus or persistent spike protein or both. So if you find ways to neutralize the spike protein, ivermectin is a spike protein neutralizer. That's a prescription. Low-dose naltrexone shuts off inflammation, and that's been used for a number of different things. I point people to low-dose-naltrexone.org, a website. But it also reduces inflammation from the spike protein. But what's in the spike support are natural products like dandelion root, which prevents the spike protein binding. You also have nattokinase. So nattokinase is a proteolytic enzyme. It breaks down protein structures floating in the blood that shouldn't be there. And that's what the spike protein is. It's this huge protein with spikes sticking out of it. And we've got to break that down. So what I have seen is I started to stock it in my pharmacy.
Oh, really?
And I stock all the wellness company products in my pharmacy. And I've had to reorder very few of the products except for the spike protein, which I carry 5 times more of the spike support product than I do any of the other wellness company products, which I love. People love the sleep product that they have. They have gummies for the children as well to boost their immune system. But without even soliciting patients to educate them on the spike protein, I have my legacy customers. I do a lot of hormone replacement therapy. I own a compounding pharmacy, and I have the spike support right next to the register. Wow. People just pick it up and buy it.
Wow.
Haven't heard of it before. Okay, they do get some marketing materials from me. Maybe they look at the wellness company Telegram channel that I communicate to, but the vast majority of purchases are people who just look at it, they see it, they've heard of spike protein, it's dangerous, they just buy it, and often they buy it without even asking about it.
Wow.
How does this work? So that is it's not a new product. It's been very successful for a wellness company for a long time. But what I think this shows both of us is that the public awareness of the problems associated with the spike protein, whether you're vaccinated or you're a COVID long hauler because you've got persistent virus, people are recognizing that now. And I've seen my sales increase of the product dramatically just here at the store.
Amazing. Well, one of the most interesting things I heard you say just now is that, I mean, you have a cross section, right? I'm sure it's like particularly choosy customers or people who are pretty much more educated about health than the average, but you're still serving a cross section of the people of Las Vegas. So what this says to me is that people outside our little subculture have heard of damage from the spike protein. Would you say that's correct?
I think so. I definitely think so. More than if I were to just guess and measure by my little barometer of the walk-in customers that I have. Actually, most of my Las Vegas customers, I use a courier to send to. Traffic is just really bad now around my farm, so nobody drives here. I ship a lot because I'm licensed in 48 states. But just the barometer, I have customers that'll just, they know me and my workstation is right beside the register. Hey, Robert, are you going to offer the COVID vaccine here? Nope.
Wow.
Why not? This was during COVID. It's ethics. So without engaging in argument, planting that little seed caused one person to think, and this man got one dose only, got sick from the vaccine. Then he got COVID. 2 years later, he says, I wish I wouldn't have gotten that vaccine. You did, didn't you? That's one thing. So I get that little measurement. But with regard to the spike protein, I'm really surprised by the number of people that just grab it. So no, they're not all people that necessarily watch the types of shows that you host or the other types of shows that I may be on for the wellness company. They're not in that column. But yes, you're right. They're more aware of natural health and wellness. I sell a lot of nutritional supplements. But that product has done so well. And really, it's just the last 3 or 4 months that I've seen a dramatic increase in the sales. So somehow people are aware, word is out, and I'm glad because a lot of people are being harmed by it, unfortunately, the spike protein.
Do you anecdotally have customers who say they feel better after they take the spike formula?
Yeah, I do. So I had a woman and her husband, and he's running for local political office here. They didn't get vaccinated, but they're with a number of groups surrounded by people who get vaccinated. They may or may not have gotten COVID. Well, I'm not mentioning their names. So they got COVID, they got early treatment. Okay, felt better right away. But the woman tells me, she says, when we're around large groups of people, because he's running for local political office, she said, we just don't feel the same when we get home. And I suggested that they start to use the spike support products from the wellness company. I suggested a couple other things too, just like I told you, hey, I want everybody to do some grounding, get out in the sun, yes, use the spike support product. And they said within a week, they just felt better. What they described was a general like malaise. I'm just not myself. I'm not super fatigued, but I'm a little bit fatigued, but no other overt symptom. They just said, I just feel back to normal. So what that tells me is these people, for one reason or another, maybe because of their previous COVID infection, maybe because of exposure, because we know that shedding is real. That's in the data. Okay. They started to use the wellness company spike support product and just felt better. I recommend it as a preventive measure because I'll be honest, I take ivermectin often. I'm the rat with his own cheese factory. I have my own doctor. I don't take it off the shelf, but I have a doctor prescribe it. But I teach at a martial arts class, and I'm not going to avoid contact with people. I'm not going to live my life in fear, but I'm smart enough to prevent exposure. And yes, I'm concerned about it. I have a couple of young kids, and I have colleagues my own age. Last point for you. I know I talk a lot. I'm sorry. But I have a couple guys. One's 2 years younger than me. One's 5 years younger than me. One 5 years younger than me, a vaccine pharmacist working for a chain drugstore. He died a few weeks ago.
So sorry.
The parents went to high school with this guy. The parents have not come up with what occurred, not really telling us, but I knew another classmate of his, he was a freshman when I was a senior, who went to pharmacy school too. So it's like, oh, hey, we kept in touch after high school. And they said, yeah, he was a big proponent of the vaccines. So I don't know what caused his death, but 43 years old, okay, that wasn't
so young.
That wasn't natural. And another one, so this story was a good story. A friend of mine in Arizona, nurse practitioner wife, his ejection fraction, with normal ejection fraction out of your heart, 65%. His ejection fraction dropped to 35%. An athletic, relatively young male can't get off the couch. That's a problem. Okay? And yeah, he had myocarditis. Oh. I got him a telemed consult with a military doctor who was prescribing it for the military personnel. We're all mutual friends. Right. He did the consult, authorized the prescription for ivermectin, and in 2 weeks, His ejection fraction was back up to 63%.
What's an injection fraction?
Ejection fraction. So you have the 4 chambers in your heart. The left ventricle, which is the biggest chamber, that pumps the blood into your aorta, which is the big balloon. And the aorta fills up with blood, and then it fills up, and it pushes the blood to keep it flowing. Fills up, pushes. So it's the left ventricle that pushes blood in there. Now, when your left ventricle doesn't push enough blood to the aorta, you just don't have the circulation. You don't have the circulation, you don't have the oxygen. You don't have the oxygen, you don't have the mobility, you don't have the energy, you don't have the strength. And that's where he was as a 48-year-old male.
Oh my gosh.
Being made fun of by his nurse practitioner wife who wouldn't prescribe the ivermectin, yet in 2 weeks, he was remarkably better. Called me, one of the few that called me, and I don't expect this, who called me and said, I just wanted to thank you because I didn't tell you. Before I was diagnosed with the low ejection fraction, I saw the doctor, the cardiologist, due to the fact that I passed out twice in hotel rooms.
God.
He travels for the company that he works for. He travels, and he said, I woke up on the floor of my bathroom, and I had hit my head because he got dizzy. And saved his life. Now, he takes ivermectin continuously, and still his wife rolls her eyes and says, you sure that ivermectin is going to help you before they go out into a crowd? Well, my point back to being objective. What's the downside? Right. And this is an N of 1, a number of 1. One guy in the study. Right. Look at the dramatic difference we had. The only thing he changed was adding ivermectin when he felt terrible and was sitting on the couch. And in 2 weeks, he's off. His ejection fraction is now normal. But look at that bounce from 35 to 63%.
Well, this is a whole new use case that I haven't heard of, that taking ivermectin formally can help with circulation and heart issues.
Well, it's the myocarditis. So the inflammation is being driven by the damage due to the spike protein. So endothelitis. So your endothelium, that's the one cell layer of your vascular wall that's in contact with the blood that's actually flowing. Well, you got the myocardium, the heart muscle, the pericardium, the sac around it, that are all highly susceptible to the spike protein. Why? Because you've had it in some of your publications. It's that ACE receptor binding site. It's that particular binding domain. And when you're making an antibody, an autoantibody to the spike protein, you're going to make some antibodies to the ACE receptor binding domains. You're going to have inflammation wherever the spike protein can bind. And where do we have dense concentrations of ACE receptors? Well, obviously, the myocardium, anywhere in the blood vessels. And here's another one I'm sure you'll pick up on too. If we look at the infertility rates, there's a dense concentration of these ACE receptors in the placenta in a woman who's growing a baby. And look at the miscarriage rate going up. Is that linked? Yes.
Do you think that pregnant women should experiment with ivermectin to protect their placentas?
Well, it's hard for me to make that recommendation without enough data. And the reason is this. Ivermectin can concentrate in the central nervous system. It can get to the central nervous system of the developing baby. So that recommendation I reserve to the learned practitioners that are your maternal fetal medicine specialists, because they have to decide if the benefits outweigh the risk, because you do have the risk of potentially an autoimmune reaction causing the woman to actually reject her own placenta.
Yes.
So you're not going to carry the baby to term. And look at the miscarriage rates that have gone up dramatically since COVID.
Absolutely. All right. Well, bracketing that, I wish that we had uncorrupted science to do uncorrupted studies of that. But bracketing that, my last question is, should young men, particularly who are vaccinated, take some maybe low dose of ivermectin periodically to protect their hearts?
Well, whether vaccinated or not, I think being aware of spike protein exposure is crucial. So I do recommend the spike support.
Right.
And you can take that every day.
Right.
My personal preference, and I may over recommend because I'm a pharmacist, so I'll self-admit, hey, being a pharmacist and having easy access to stuff and knowing the telemed practitioners, yes, I would recommend once, twice, or even 3 times a week dosing of ivermectin. Perhaps that's situational. So let me tell you about older relatives that would take a cruise, unvaccinated, take a cruise. Hey, every day on that cruise, please take it because of the exposure. Because in this case, in cases like these, and having some friends around me that they've either gotten sick or one unfortunately died, I know I'm not going to harm anybody, with the recommended dosing of ivermectin.
Right.
What's the downside? The downside is, okay, they have to pay for the consult and pay for the drug.
Right.
Okay. But if you're unvaccinated, my assumption is that your spike protein load is far lower than that of those who are vaccinated. And not everyone who is vaccinated has the symptoms of the low cardiac output, the fatigue, and the inflammation. Okay, I still think they may have spike protein. There are ways to test for this. There are qualitative and quantitative tests for the spike protein antibody, but not necessarily the spike proteins. But you can infer, okay, you've got the antibody, you must make that antibody because you've got spike protein. Yes, in that situation, I would recommend taking the ivermectin. But how long does it persist if you have a vaccine? Well, we don't know. Some data shows that, well, we know the spike protein persists for about 6 months, or maybe it's at least 6 months. Some people, they have persistent spike protein elevation, even if they've only had one vaccine. And I don't have enough information, I haven't reviewed enough information myself yet to just say that this is the case all the time. It varies. So no downside. I do recommend it. Spike support for sure, because you don't need a prescription for it, easy access to it.
Fantastic. Well, I feel so much less despairing after I talk to you and your colleagues than when I don't talk to you and your colleagues. So thank you so much. You've given us really concrete ways to protect ourselves and our loved ones, and even to have emergency backup if needed. Where can people find you, Dr. Seik, and where do they order these products from?
So everything is through the Wellness Company website. I know you have your own link to it. And the company told me that when these launches occur, those will all be linked to you. So it's twc.health, and I don't know, your slash is what, DailyClout?
Probably DailyClout.io.
Yeah. So that's where. So you just go under virtual care, and you'll find the options available. So the medical emergency kit, which is the antibiotics primarily, that's available now. The COVID emergency kit launches Friday.
Awesome.
So twc.health/DailyClout. That's where to find it.
Thank you so much for everything you do, Dr. Seik, and thank you for being fearless to protect everyone's health. We appreciate it so much.
Okay, thanks for having me on again.
Hey everyone, it's Naomi Wolf of DailyClout, and I just want to give a thank you to our sponsor, the Wellness Company, whose chief medical team includes some of our most respected colleagues, including Dr. Peter McCullough and Dr. Harvey Risch. So the Wellness Company offers COVID and vaccine injury treatments, including ivermectin, as well as dietary supplements based on the guidance of these noted physicians and epidemiologists, such as Spike Support, which is designed to help combat spike protein. So click on the link below or head to dailyclouthealth.com to purchase their products. You can also gift healthcare to your loved ones, which is something I've been doing. I'm excited about the Wellness Company being able to offer medical advice without the pressure of big pharma. Please use the code DailyClout for 10% off. Thank you again to the Wellness Company, our sponsor. Bye-bye.